Hi, I'm Dr. Sam over at Live Your Life Integrated Health, and today we're going to talk about how functional medicine approaches hormone health, and specifically how it approaches hormone health differently than typical Western medicine. And in the next weeks, the next months, we're going to really start talking about how our hormones change throughout the month, what symptoms they can present with if they're not balanced appropriately, and how to start fixing those symptoms. But today we're really just going to take a quick look into how functional medicine treats hormones differently. All right, so who am I? I'm Dr. Samantha Bolt. I am a certified functional medicine practitioner. I'm also a doctor of chiropractic. I have over 600 postgrad hours now in functional medicine and hormone training, and I myself was a painful cycle survivor, and that's what got me so interested into hormones in the first place. And we'll go to that story in just a second here. I also had Lyme disease in my early to mid 20s and made it through that. And so there's definitely a few different things that my body's gone through. I know what a lot of you guys are going through. I've come out the other side. And I believe that your ability to show up in this lifetime for the ones you love, which should include yourself, is completely dependent on the health of your body and mind. If we don't have our health, if we don't feel good, it's hard to kind of show up not only again for ourselves to do those activities that we love to do, but for our loved ones, right? We end up taking it out more on them. We don't get to hang out with them as much because of the way that we're feeling. And so that's always my thing is for my patients, I want them to be feeling as good as they possibly can so that they can do all the things that they want to accomplish in life. So how did I get started in the hormone world? So at one point in time, I was happy, carefree, loving life, and then I turned 14 and I got my first period, and it was atrocious. Basically every month, and I wasn't even regular. So who knows when it would come, but about once a month, I would just end up crying on the floor, rolled up in a ball in pain for 8 hours plus. And it was terrible. I couldn't believe that people had to go through these things. And after a few months of this, my mom was like, all right, we're going to take you into the doctor. We're going to get some answers. We're going to do some testing. Let's see what they have to say. And what did they end up doing? Pretty much absolutely nothing. They really didn't ask any questions. They did no testing. And when they asked what we wanted to do, they're like, really the only options are birth control and perhaps we can try an anti-anxiety medication. Now, my mom has worked at a pharmaceutical company for most of her life. She has some idea of some of the outcomes, some of the side effects of a lot of these different pharmaceuticals, and she was not prepared to put her 14-year-old daughter on birth control, especially when we didn't have that why answered, right? Why was this happening to me? They couldn't tell specifically. They were just going to cover up and hope that that birth control worked. So I continued to basically have these terrible periods into my 20s. And it was just one day a month that everything just went horrible. And there were other times throughout that month, looking back, that I should have known better. I was more fatigued throughout the month than I should have been. I was more anxious than I should have been. I had more acne. I had some digestive issues. All of these things throughout the month were more minor. They didn't bother me as much, but they were definitely still there. But I never really thought about how my hormones might necessarily be affecting that. And Dr. Laura Bryden said this really well when she says that your period is basically your monthly report card. So depending on how well your period is, how regular it is, the symptoms that you have, that can tell you a lot about the other symptoms, the other things going on inside your body. And my body was definitely not getting an A. My periods were terrible. And then I kind of felt that throughout the rest of the month as well. Things didn't go as well the rest of the month as they should either. But as I grew up, as I aged, was able to take some steps that I could at least plan a little bit better, know what to do heating pack, ice pack wise, right, in order to make these better, but it wasn't really fixing the problem. And so finally, getting into grad school, going into chiropractic school was fairly well-rounded. We had a lot of nutrition classes, functional medicine clubs. We were able to learn a lot of this stuff. So I spent basically 2 years changing my diet, adding in supplements, doing my own testing because I couldn't find anybody else that would do that testing to figure out what was really going on with my body. And it took, 2 years or so, because at the moment I didn't know what I was doing. It was kind of my first delve into the hormone world. But eventually, and now I have really good periods, right? They're regular, there's no symptoms. I know what's coming because I track it, but not because I get a few days to a week of these pre-symptoms beforehand. No more pain, cramping, rolling up in a ball, and a lot of those other things throughout the month, right? The energy issues, the skin, acne issues, the anxiety, the stomach, digestive issues, those all cleared up as well. And that's what I want for everybody, is to have more hormone information, to understand their hormones better, so that you can also understand hopefully your health better and have that better quality of life, not having to have these other symptoms that are holding you back. So how do we kind of change that? Because obviously when I went in the traditional route and I had gone to multiple practitioners, it was not just one practitioner that I got basically the same answer from, it was multiple. There was really only the birth control option. They never even mentioned, supplements, what I was eating, stress management techniques, all these different things, right, that could have played a huge part to younger me. So the traditional model is typically looking more like this, right? We're treating symptoms. We are waiting for patients to have a symptom, to have an issue before we, take action. And we have found out with other countries that wellness prevention medicine really is much better for people, for the community as a whole. We end up having less chronic issues. We end up having less emergency issues when we're looking at wellness and prevention, not just waiting till something happens and then trying to step in and take care of the problem. It's more drugs and surgery based. So those are typically the answers that we have in Western medicine, is what medication is going to work for you or what surgery is going to make this better. Very rarely are we talking about other steps that we can do. A very one-size-fits-all approach. And what that basically means, again, is, if you have hormone issues, you get birth control, right? There's not really a ton of thought going into that. And we see that a lot in the medical system. Reactive and reductionistic. And again, so that means a little bit that, it's reactive. We're going after symptoms. Reductionistic means that Western medicine has kind of parted ways with the body, right? They have their different little segments. We have our endocrinologist that looks at hormones. We have our gastroenterologist that looks at the gut. We have some that look, at the immune system. But there's very few doctors that are looking at the whole body, and that's how our body works. It's a whole body. Everything connects. We can't just look at one piece of the puzzle and expect to be able to put it together. And then it can be extremely expensive and financially draining. I mean, that's one of the biggest causes of bankruptcy in America, is the healthcare system. We end up with a cancer, a heart surgery, diabetes, anxiety, hospital stays, emergency room visits. These all add up. If we didn't have those, it would be much more cost effective. So functional medicine, we're looking more at preventing, and what are those root causes, right? Can we get ahead of the game? And if we can't, and we have a patient coming in with symptoms, what is really causing that issue? And that's what we're going to really focus on today. Treatment depends more on lifestyle, diet, supplements. We can go medication route, right? We talk about that with patients, but it's not usually our first option. We are usually looking to see if there are other ways that we can address this problem first. Medications, when we add those in, are often fixing one little piece of the puzzle. When we can go further upstream, when we can work more with the body as a whole, we often get to fix multiple pieces of the puzzle at once, not just that one little one. Customized and personal, we spend a lot of time with patients. We work one-on-one with patients. It's very individualized, each of the treatment plans. Proactive, big picture, we're looking at that body as a whole, right? We're looking at all the different systems and how they're interacting. And affordable and saves money long term. What that means is taking better care of your health now, right, is going to save you a ton in the future. All right, so that's some of the differences between traditional and functional medicine. And the biggest current issue with modern medicine is that it defines diagnoses based on symptoms and not on the underlying cause. So I'm going to say that again. The biggest current issue with modern medicine is that it defines diagnoses based on symptoms and not on the underlying cause. And that is one of the big ways that functional medicine differs in how we treat hormones. While it's important to know your symptoms, two people with the same symptoms can be coming in for very different underlying causes. So what are some of those causes that we're looking at? So True diagnoses in the functional medicine world are going to typically be more about communication. Our nervous system, how our brain, our nerves are firing and signaling throughout the body, and then our endocrine system, our hormones, right? How are those hormones being relayed from the brain to the different organs back in this feedback loop back to the brain? Assimilation, that's typically more to do with our gut. Do we have a healthy digestive tract? Do we have healthy cells? Are they actually able to absorb the nutrients that we put in? And can they stop bad things from getting into our bloodstream? Or are we not, is that not strong enough defense there in order to stop those bad things? Now, assimilation can also talk about skin. It can talk about respiration, but the digestive tract is definitely the biggest one that we deal with there. Biotransformation and elimination. So detox, right? I know that's a huge fad, huge trend in the health world, but it's so true. If our bodies aren't properly ridding themselves of junk all the time, we are going to get sick. Biotransformation elimination is probably one of the biggest ones too that I work with when it comes to hormones. We have to make sure that our waste management systems are up and running, our garbage men are going around our body, grabbing all the different garbage, cellular waste, environmental toxins, processed food, leftover stuff. I mean, right, there's just so much junk in our system nowadays. We have to be able to get it out. Transport, that's typically more the blood and the lymph system. Are they properly able to transport nutrients around the system? Energy, this is a big one, mitochondria. Those little powerhouses that are supposed to make energy so that we can make reactions happen in the body. If they aren't working appropriately, we are going to start feeling that. Defense and repair. So that one is more immune system and inflammatory system. So do we have a dysregulated immune system? Is when we have inflammation, because we need it sometimes, is it able to calm itself down? And then finally, integrity. This is looking a little bit more musculoskeletal, fascia. How is that working? How is that pulling on each other? So when we're looking at diagnoses, this is really where we're coming from. And so I put in here, let's see, we've got osteoporosis as a possibility, but one person may be coming in with osteoporosis because they're not detoxifying properly. So they are becoming more acidic, and we're pulling more and more calcium out of the bones in order to buffer that, where other people may have osteoporosis more due to an immune system or an inflammatory reaction. So because of that inflammation, they're constantly breaking that bone down more than they should. Now, those are two very different reasons, but they're presenting with the same symptom, osteoporosis, right? Now, we can't fix that very well unless we know why they're presenting that way. Hashimoto's, so that's hypothyroidism for the most part. And again, these can be two different very reasons. Communication issue, is the brain properly signaling? Is the nervous system properly signaling? Or defense and repair, again, that immune system may be extremely dysregulated. So knowing that underlying cause allows us to be able to make a better plan for this patient. Chronic fatigue. Again, assimilation. One person may be having a terrible digestive tract. Their gut may be weak. They may not be able to absorb nutrients appropriately. Now they're nutrient deficient. Of course, they're going to be having chronic fatigue. But another person may not be eliminating properly. They have junk all over their system, causing a very irritated system, and that's what's giving them the chronic fatigue. Now, for most patients, it's not going to be just one of these things. Sorry, putting more in here. And perimenopause symptoms. So this one shows it more because I work with a lot of women with perimenopause symptoms. Yeah, we're going to probably find 3 to 5 smaller ones and then 1 or 2 really big things in their system. So again, no. Is everyone going to have just one of these diagnoses? No, they're not. Most patients that are coming into me are going to have multiple of these, but it definitely gives us a better idea of how to help that patient, what needs to get fixed, and what that plan, that path looks like moving forward. So how does functional medicine differ from typical Western medicine? Well, this is kind of it. It's in our diagnoses is one of the main big ones, right? We're looking at communication, assimilation, detoxification, transport, energy, defense and repair, integrity. We're really going down to that root cause to say, okay, I know you have PCOS. I know you're having endometriosis. I know these are the symptoms you're presenting with, but why? Why are you presenting with those symptoms? Which of these boxes or multiples of these boxes is not working properly in your body? Functional medicine also has different lab ranges and looks at patterns differently. So we have this patient over here starting with that glucose, the hemoglobin A1C, insulin, iron. and basically what their numbers were, plus the reference ranges that is typically used in Western medicine. And some of these reference ranges are really wide. They're not necessarily what we want for an optimal human. Of course, we're going to start having some health problems. So when we're looking at these typical reference ranges, we're going to see that this person is pretty much normal for the most part. But when we look at our now functional medicine, these optimal reference ranges, all of a sudden this person is out of range on almost all of them. And when all of these are not optimal or suboptimal, yeah, it's no wonder that we're going to start feeling more energy issues, more hormone issues, more fatigue, more anxiety, all these different things, right? So functional medicine does look at different lab ranges, and we'll look at the pattern sometimes. Even if someone comes in fully within range of everything functional medicine wise, which almost never happens, we'll still look at some of those patterns too to say, okay, if this one number is really high, this one number is really low, these should be more connected. We don't want to see that pattern with these two different markers. Functional medicine does more in-depth testing. So again, when we're coming up with some of the basic things that Western medicine tests, glucose, hemoglobin A1C, looking at blood sugar, well, functional medicine is typically going to take that next step and actually look at insulin. Insulin is the most important one when it comes to blood sugar balancing, and it's the most accurate one when it comes to blood sugar. So some patients can come in here with perfectly normal glucose and hemoglobin A1C, but their insulin is going to be out off the charts. And so of course we're going to start looking at blood sugar dysregulation when that insulin isn't where it's supposed to be. Iron is just what's in our bloodstream. Ferritin shows us what we're actually storing in the body. Saturation percentage is how many iron cells are actually, how much iron is actually attaching to cells. So we're getting these extra markers to show not just what's in the bloodstream, but how is our body actually utilizing this. TSH, right? That's not a thyroid hormone. That's a brain hormone. That's the brain sending a signal to the thyroid. So it doesn't actually tell us necessarily what that thyroid is doing. It's giving us an idea, hopefully, of what that thyroid is doing. But without actually testing T4, our inactive thyroid hormone, T3, our active thyroid hormone, and potentially those thyroid antibodies, we don't know what the thyroid is making or what the immune response is to that thyroid as well. And then estradiol and testosterone. So estrogen and testosterone are two common ones tested. But we want to make sure that we're testing all these other hormones if a patient is having hormonal issues. And we'll do other tests besides just blood work. We have stool testing, genetic testing, nutrient testing, food sensitivity testing, heavy metals testing. I work with the Dutch test a lot when it comes to those hormones. And it gives us a much more in-depth look at what your body is doing. And finally, functional medicine chooses quality of life over length of life. So when working with patients, we're not just thinking, what you're doing right then, how you're going to be feeling, what your health is going to be like the next few months. We're always thinking about where people want to be in 10, 20, 30 plus years down the line, right? So length of life is important, but it becomes less important if we're giving up being able to live independently, being able to remember who our loved ones are, being able to walk a mile, being able to play with our grandchildren, right? When we take all of that kind of stuff away, what becomes more important, the length of life or quality of life? We're seeing more and more that people are spending 10, 15, 20 years in memory care facilities, right? And these different facilities at end of life is just not what we want for most of our patients. So what's more important, length of life or quality of life? We actually have that conversation with our patients, right? You get to decide that answer. We just want you to know what those options are and what your choices are, right? We want you to know that that's an option. And with a lot of these medications, what we're sometimes seeing is we're increasing that length of life, but that quality of life is drastically taking a dive. And so we just want our patients to be aware of that. All right, you guys, so that finishes up today. Kind of how we treat and how we look at things differently, and especially when it comes to hormones, how we, again, diagnose differently so that we're really getting to that root of the problem, not just that sublayer, not just what your symptoms are, but what's actually going on beneath. So hopefully you'll join me next time as well when we start actually talking about hormones and what they look like throughout the month.